have this discussion on coming together on the homelessness crisis here in the city of Ukiah, and of course, talking about the county of Mendocino. My name is Mike McGuire. I'm honored to be able to work with you as state senator here on the North Coast. We're going to get started here in just a few moments as folks make their way into the community meeting on Zoom. We're also streaming live on YouTube tonight. We're streaming live on the county's Facebook page tonight. We're going to welcome comments multiple ways tonight. So we want to make sure that you have an opportunity to be able to have your piece. We want to hear from you. It's so critical. The most important part of this evening is hearing from each and every one of you, no matter if you're on Zoom, on Facebook, or watching YouTube. So if you are on Zoom this evening, again, welcome. We are so grateful that you've joined us. If you can put your questions into the Q&A portion at the bottom of your screen, there's a Q&A icon. Feel free to put your questions, your comments, your concerns, your criticisms in there. We're going to get to as many questions, comments, criticisms that may be there tonight. If you would prefer, we have some folks joining us on the phone. You can also email us. You can email us at senator.mcguire@senate.ca.gov. Again, we're taking your questions, your comments, your concerns tonight via email as well, senator.mcguire@senate.ca.gov. If you'd like to ask a question, if you have a comment, a concern, or criticism, you're on Zoom, make sure you place it into the Q&A icon. We'll get to those this evening. If you'd like to email us, senator.mcguire@senate.ca.gov. Again, it is the most important part of this evening, hearing from each and every one of you. All right, ladies and gentlemen, we're going to now get this town hall started. We are so appreciative that you have joined us this evening. Again, my name is Mike McGuire, and I'm incredibly grateful to be able to work with you representing this amazing county of Mendocino. And know that everyone is incredibly busy, so it means so much that you are going to be able to say your piece here this evening. We are appreciative to the county of Mendocino. We're appreciative to the city of Ukiah and the California Department of Housing and Community Development for their partnership in this evening's community meeting. Tonight, we're going to be coming together to talk about the homelessness crisis and provide some critical updates. I want to assure you, this is the first of many meetings to come on the Best Western project. I also want to say, this is not a marketing ploy tonight. We will be talking just the facts. We want to do a deep dive on the Best Western project, how we got here, where we'd like to be able to go, and to be able to get your feedback. Some quick background on how we got here. $600 million has been secured this year by the legislature and the governor to invest in permanent supportive housing to address the homelessness crisis here in Mendocino County and candidly in all corners of California. These funds, as directed by the state of California, must be invested. They must be spent by December 31st of this year by local governments. The funding program that purchased the Best Western is called Project Homekey. We're going to do a deep dive on that program here in just a few moments. And the state, I got to say, the state has been growing increasingly concerned about the homeless population that exists here in the North Coast, but also throughout rural California. And behind the beauty of where we live here on the North Coast, there are some ugly statistics. Mendocino County has the third highest homeless population in the entire state of California per capita, the 12th highest in the United States of America. Just north of us in Humboldt County has the highest per capita rate of homelessness population in California, the third highest in the country. The North Coast has some of the highest opioid addiction rates in the West, along with some of the highest rates of child abuse, some of the highest rates of child endangerment, also called adverse childhood experiences. Homelessness, opioid addiction, adverse childhood experiences, and childhood poverty, they're all related. And I'm not saying this to scare anyone, but to be able to tell the truth here tonight, to tell the truth on why the status quo is simply unacceptable. And I also want to be candid. Sacramento, they haven't always focused on rural communities as they should have. And I think that we can all say that's shameful. Working with the legislature and the governor, though, that's changing. We've made it our mission to invest homelessness funding where we need it most, and per capita, that's in rural California. Our approach at the state of California has been data-driven and intentional. We are investing the funding in communities that face the biggest challenges with homelessness. And just 6 years ago, by contrast, when I was sworn into the state Senate, not one dime of homelessness grants were invested north of Sonoma County. And in the meantime, the homeless population has continued to grow. Now we're seeing tens of millions of dollars. But let's be blunt. Now that the resources have arrived, additional challenges have risen up. Some in the community, some are angry and frustrated about the lack of a public process heading into the purchase of the Best Western. And if you're frustrated and if you're angry, you have a right to be. No one likes to be surprised. I hate it. So you have a right to be frustrated and you have a right to be angry. That said, Mendocino County was mandated to move with speed to address the major issue of homelessness because of the December 31st deadline that the state has imposed on all 58 counties. Tonight, though, we want to turn the corner. We want to start focusing on a new approach. Tonight, we're announcing, thanks to the leadership of Mayor Crane, Supervisor Haschak, the Board of Supervisors, and the City Council, we're announcing the formation of a new 2x2 committee that will be formed between the City Council and the Board of Supervisors, focus on developing a holistic vision to tackle the homelessness crisis that exists on our streets, to get out in front of any potential projects and determine how to address the best strategy to tackle homelessness in Ukiah, understanding that this one project will not be the silver bullet. This evening's meeting, I want to assure you, once again, is just the beginning of the process that the county will be launching on this particular project. The county will be hosting a series of community meetings in the months to come on how the development will be managed, who will live in the units, what potential mitigations may be needed, and of course, more issues will come up here in the weeks and months to come. Finally, homelessness is a challenge that isn't going to be an easy one to tackle, and it is a big problem to overcome here at home and throughout the state. It's going to take multiple strategies, including economic development and job creation. That's why we partnered with Mendocino College and the county to be able to secure $1 million to expand the Construction Corps program at the college. We've secured $5 million to start the Bachelor's of Science in Nursing program to be able to provide family-sustaining wage jobs in healthcare here in Mendocino, Humboldt, and Del Norte counties. And that's why the state is now investing $150 million annually to expand career training programs in all of California high schools. That said, we know that there's a lot more work to do. The bottom line about tonight, we want to hear from you. So here is the agenda, if it works for each and every one of you. Tonight, we're going to hear from Jeffrey Ross. Jeffrey is the Assistant Deputy Director of the California Department of Housing and Community Development. He's a North Coast kid. He's always lived on the North Coast. He knows our hometown. He's going to provide a deep dive in the Project Homekey Program. We're also going to hear from Megan Van Sant. She's a Senior Program Manager for the County of Mendocino Health and Human Services Agency. And we also have nonprofit leader Paul Fordham on the line tonight. He's the Deputy Executive Director of Homeward Bound. Paul and Homeward Bound, they run developments similar to what is being proposed in Ukiah with the Best Western, and he's going to give us a flavor of how those developments are operated. And Ms. Van Sant, she's going to be giving us a preliminary overview of the development. She will be doing that deep dive here tonight. We're also grateful to have the CEO of Mendocino County on this evening, Carmel Angelo. Ukiah City Manager Sage San Giacomo is coming to us live from City Hall as well. But again, the most important part of this evening is having a conversation with each and every one of you. Please connect with us. Send in your questions, send in your comments now. Email us, senator.mcguire@senate.ca.gov, or simply go to the Q&A box, put your comment, your question, your criticism into that box, and we'll get to them here shortly. All right, so let's get into it. We are so grateful that we have the chair of the Board of Supervisors here tonight. His name is Supervisor John Haschak. Sir, the floor is yours. We welcome you, sir, and thank you for your hard work.
Well, thank you, Senator McGuire. And we certainly, from the Board of Supervisors, we certainly appreciate you helping to organize this town hall to discuss the Project Homekey. that, as you're aware, that the Board of Supervisors voted unanimously to approve this project because we realize that Mendocino County has a homeless problem. That we see working families that are living in their cars. We see veterans living underneath bridges. We see people suffering from mental illness who are living on, vacant lots or outskirts of our towns. So we think that this Project Homekey is a chance for recovery for a substantial number of people. I want to thank the county staff for their incredibly quick work on advancing this project to where it is right now, and also to Senator McGuire for coming through, because when the Board of Supervisors ask you to do a town hall in Mendocino County, you certainly accepted it and going full bore on it. So we appreciate that. We think that there's lots of opportunities, and certainly there are concerns about this project. We hope that this kind of discussion will take care of some of the issues and start this process. So thank you again.
Thank you so much. That's Supervisor Haschak, the chair of the Board of Supervisors here in Mendocino County. Ladies and gentlemen, now would like to be able to transition to hear from the mayor of the great city of Ukiah. If we could welcome to the floor, Mr. Doug Crane. Mr. Mayor, good evening. The floor is yours.
Thank you. Adding to the remarks of the chair of the Board of Supervisors, thank you very much for your involvement, for your outreach to the community, to help us see our way through this new challenge / opportunity. There are going to be some severe challenges, or it is severely challenging for the community to digest this on a time frame that is completely new in terms of what government typically does in terms of timing and participation of the populace. As you've addressed, that has created some challenges, which we will have to work our way through. But with people working towards the goal of reducing the people in severe need, the quantity of them that don't have shelter, this is an important start for our community with this particular program. Thank you.
Mr. Mayor, thank you. We are so grateful that Mayor Crane, representing the Ukiah City Council, is with us tonight. Thank you much, Mayor Crane, for your opening remarks. Ladies and gentlemen, we're now going to keep moving into our agenda. We're going to start here with Jeffrey Ross. Again, he's the Assistant Deputy Director for the California Department of Housing and Community Development. Bottom line, he oversees Project Homekey. He's going to be focusing his remarks on rural California, why the need is so great here in rural California. He's also going to be talking about how this program works, what is permanent supportive housing, and how it has actually made some differences in big cities, in small. Mr. Ross, you have 5 minutes. The floor is yours, sir. Good evening.
Thank you, Senator, and thank you to everyone for inviting me to participate today. It's really critical that I emphasize that this is all about partnership from the state with local communities. And as the Senator pointed out, that partnership, especially on the rural side, hasn't necessarily been there the way it should be. And so we're super excited in this moment to be able to be partnering with you and with communities just like yours all around the state. Project Homekey came to us on as part of the state budget back in June 29th of this year. It passed, as the Senator said, with $600 million. $550 million of that is in what's known as coronavirus relief funds coming from the federal government, and it has a 11:59 on December 30th expenditure deadline. That means at midnight, at the start of the day on December 31st, those funds no longer exist. And so with that kind of time period and deadline, we really had to think creatively how to partner in a way that we've not partnered with any type of jurisdiction or public entity before, and really look at what is it going to take for us to be successful to address homelessness and those at risk of homelessness in the age of COVID. This is a public health intervention linked to housing, because housing and public health are inseparable. If we want to be able to make sure that we're protecting our most vulnerable, we need to make sure that we're able to do that in a way that really does create a safe space for everyone. So what we were able to do was, again, budget passed on June 29th. On July 16th of this year, we announced what is known as the Notice of Funding Availability, saying that $600 million was available to jurisdictions and partners around the state. We divided the state into 8 regions, and the North Coast is part of what we really targeted in terms of the rural California and what was known as the Balance of State funds. And that's critical because in the past we haven't successfully been able to reach out and fund especially homeless interventions in our rural communities like we're seeing right now as part of Homekey. And I'm very proud to say that that the city and the county were one of the very first ones to be able to come in. We had a very expedient deadline. So we launched the program on July 16th. We said for priority applications to guarantee funding, applications had to be in by August 13th under this priority application period within the geographies. We said that we could continue to accept applications all the way up to September 29th. But by October, all of our applications had to be basically fully vetted, and we had to make all of the awards to make sure that we were able to expend these dollars by that tight deadline. That meant that there wasn't a lot of time on the front end to really do what we're used to seeing in terms of very broad planning and community engagement and outreach. What we had to be able to try and do was to create a pathway where opportunities that presented themselves could be secured and then really begin what we're doing right now this evening, which is that more robust community engagement, making sure that programs honor and respect all the hard work that folks up and down the state have been doing for years in terms of dealing with homelessness. We've been very successful. We have 53 public entities, that's community colleges, tribes, cities, counties, housing authorities, that have partnered with us at the state to create 94 projects. And because of the type of response that we've seen in Homekey, the legislature granted us $200 million more. So we actually have an $800 million state-funded program. $750 million of that funding comes from the federal government as part of the Coronavirus Relief Fund. And on top of that, we've got an additional philanthropic fund. So another $46 million came in over the top from philanthropic partners. So what you're looking at right now is an $846 million program that launched at the end of June, that has an expenditure deadline at the end of December. And we're going to bring online within that tight time frame statewide over 6,000 units. And what that's going to mean is that we're going to house within the next 2 to 3 months from tonight, we're going to house 9,000 to 10,000 individuals, and we're going to do it at a cost that we've never seen before. The state contribution for these units is at $123,900 roughly right now per unit state cost. We're trying to make sure that every applicant, so the 53 applicants I mentioned, also gets an operational subsidy to support operations for the first 2 years. When you calculate that in, the total all-in cost from the state right now is $138,000 a unit. I think most folks will recognize that California is an incredibly expensive state to live in. To create these units elsewhere, it is not uncommon to be anywhere from $350,000 to $600,000 depending where we're in the state. So we're able to produce a lot of units very quickly, but it's required immense partnership and a lot of pressure from us onto our community partners. And again, I want to thank the city of Ukiah and the county of Mendocino for meeting us and coming through these timelines.
We have about 1 minute, Mr. Ross. I apologize to interrupt.
Thank you, Senator. So I just want to continue to say that this type of impact never been done before. Our ability to reach rural California to the extent that we're reaching it now, again, something that's never been done before. And it's all in partnership with communities like yours. And so I'm very humble and happy to be here this evening, and I look forward to the conversation. So with that, Senator, thank you.
Thank you so much, Mr. Ross. I appreciate it. Not at all trying to be rude to any of our panelists. We just want to make sure that we get to your comments and questions. Again, if you'd like to be able to ask a question tonight, you can email us senator.mcguire@senate.ca.gov. You can post your question, your comment into the Q&A at the bottom of your Zoom screen if you're on Zoom with us. If you're watching on the Facebook, on the Mendocino County Facebook page, we're taking your comments and your questions there as well. All right. So we heard an overview, a 30,000-foot view about the program and how it's moved in the state of California and why there's been such a truncated timeline. Now we'd like to be able to talk about the management models. So we thought it would be good to be able to have a nonprofit here who is one of the best in the state. They are Homeward Bound. They do a lot of work with permanent supportive housing. And we're going to turn it over now to Paul Fordham. He's the Deputy Executive Director for Homeward Bound, to be able to give us a look at what a potential development may look like and how the management works. Mr. Fordham, you have 5 minutes and we welcome you to the town hall. Good evening, sir.
Good evening. Thank you for the invitation. I'm thrilled to be here and happy to describe a little bit of our experience at Homeward Bound. So we're in Marin County. Homeward Bound, we run 5 shelter programs, and we also run 12 supportive housing programs. Many of those have been developed in the past 10 years. And what we see as good management of the program and what's been really successful for us is sort of threefold. It's being responsive to the community at large, hearing what people's concerns are, and being having a point person who can directly respond to the community. Also being very responsive to the people in the housing units, making sure they get what they need. And then also making sure our staff, there's the right amount of staffing and that we're able to run the program successfully. A successful program for us is taking somebody who's really disconnected, being able to house them quickly, and then to be able to, housing somebody who's been outside, that's the first few days in housing, that's just a step in the journey. Then we need to make sure they're getting the resources that they need to thrive and become productive members of society again. So for us, we really focus on getting any resources for children. For example, right now, it's very hard to do distance learning from school in your car, right? So get them inside into supportive housing. We get them a safe internet connection, connected with the school system and an iPad so they can learn, making sure they get healthy food so they can grow. With seniors or homeless adults, we get them connected to medical resources. It's hard to have things like dialysis or any wound care even when you're in an encampment. So we want to get people inside to get the treatment they need. And on there in terms of wrapping around folks. In terms of the community at large, we think it's really important. We're a community-based nonprofit. Many of your nonprofits in Mendocino and Ukiah are very similar. They're community-focused nonprofit. We're here as part of the community solution. So we want to be responsive if people say, well, I'm concerned about litter, or I'm concerned about one person moving in and they're moving everybody else they know. We want to be responsive to those questions. And I think it's the same here. So good management is being responsive and saying, people who move into these housing units, they have a lease. Same as when you rent an apartment, you have a lease. And it's making sure they understand the terms of the lease. And if those terms are broken, what are the accountability of that? So there's an accountability both to the surrounding neighbors and community and being responsive, and also the folks who are in the units, making sure they understand the terms of the lease. We also think it's important for good management to work with our community partners. There are many folks already serving these folks, but it's hard to serve them when they're outside. So the people are already connected often with the behavioral health system or with the medical system or the school system, but they're constantly moving around. It's hard to make appointments or make those appointments or charge your phone. And so supportive housing allows those connections to deepen, but it also allows the provider of the housing to have reliable partners in the community. We're making sure we're connecting folks to the resources that are already there, and then helping them return to work. You mentioned the jobs initiative. The amount of people who go through housing and within 6 months are back working again is remarkable. You wouldn't believe it. For us, we've housed, in the past few years, we housed over 200 chronically homeless families and adults. Over 98% of them are still housed. We're working to get them what they need to stay housed. They're paying a third of their income in rent. and they're following the terms of their lease. And then for us, a quick example I can give you is, I understand concerns of neighbors. We put a program in the heart of Larkspur, a very wealthy community, a block from downtown. People were very concerned. Now the community has seen how we run the program, how we respond to their needs and their concerns, how everybody has stayed housed who we initially placed in that housing. And those folks are now working as ushers in the local movie theater. They're working in a local thrift store. They're engaged in the community, and the community itself is engaged with us, calling bingo for the community activity night and providing holiday meals. So it's really a two-way community-based solution to homelessness. So it starts with housing, though. It really starts with housing. And when people have stability and hope, they're able to transform their lives. And that's what we're offering by having this supportive housing. We're not putting people in a house and saying good luck when they've been outside for a while. We're putting them in a house. We're wrapping around with support that they need. And then we're also addressing our community members' concerns and saying, we're here when you need somebody to ask questions. And yes, there's a lease, and yes, there's consequences. It goes both ways. So that's how we see supportive housing. I think it's very similar here, having spoken to some of your providers and some of the people overseeing this program. I'm happy to answer questions as appropriate later on.
Paul, thank you so much. That's Paul Fordham from Homeward Bound. We're grateful for you being here. Ladies and gentlemen, we are now going to really go in depth about the preliminary vision of the Best Western Project. The project manager, if you will, is here tonight. And I just want to say thank you to Megan Van Sant. Megan Van Sant is a senior program manager of Mendocino County Health and Human Services Agency. She's overseeing this project. She is going to go and do the deep dive, the who, the what, the where, the when, all aspects of this project. I say it's preliminary because there's a lot of public input in the months to come that Megan and the county is going to want to be able to take in until a potential formal vision is adopted. So Ms. Van Sant, 10 minutes, if you will, give us that deep dive on the Best Western Project.
Thank you, Senator McGuire, and everybody else in this call. So my goal here is to give you an overview of the project, what the actual building is like, what the financial model is, and how we're going to plan the programming for the building. And then I'll share a little bit about some of the people we're imagining will be living in this building. So the county purchased the Best Western Motel on Orchard Street. Escrow was just about a couple weeks ago, so the purchase is complete. And the building includes 56 units and an on-site apartment. Each unit is about 300 square feet, and it comes with 1 or 2 beds, a dresser, a table, a kitchenette, and obviously a bathroom. The resident population will include seniors, veterans, individuals enrolled in our whole person care program, people at high risk of COVID-19 complications, and small families enrolled in CalWORKs or child welfare services. And by small, I don't mean they're like physically small, or although they could be, but the rooms are not large, so it'll be families with 1 or 2 children. We're also going to have a portion of the unit set aside for flexible uses, including those for residents who might be fleeing domestic violence, or seniors involved with adult protective services, or individuals with complex medical conditions. So this is the kind of individuals and the demographics that we're hoping to house in this project. The project is financially sound by design. It was deliberately designed to provide housing to those individuals and families who are already eligible for subsidized housing through government programs. That's why we intentionally chose to emphasize seniors, veterans who often come with housing programs attached to, because they're veterans. Families, again, have access to housing support through our state CalWORKs program. Sometimes if they're involved with child welfare services, they're eligible for other kinds of housing support. So again, the project was designed so that the individuals who move into it come in with a government program attached to them, which usually, in almost all cases, also includes case management. So because of that model, the vast majority of the people who will be housed in the building will be able to sustain ongoing fair market rent through their own financial contributions, together with the programs that partially subsidize their housing costs. So I think it's really important to emphasize this is not free housing. Everyone living in this building will contribute 30% of their income toward rent. That's a standard practice in low-income housing projects, and we are absolutely going to replicate that in this project as well. This Homekey project is also designed to engage those homeless individuals who want to permanently recover from homelessness. The project design includes a phase 1, what we're calling a Life Essentials program, and it's a 3-month phase during which the individuals who move in will be provided with the support they need to rebuild the pieces of their lives, whether that's a financial or economic, physical health, emotional health, education, job training, job seeking. When you've become chronically homeless, living on the streets, a lot of the basic building blocks of your lives have fallen by the wayside in some way. And we want to be able to support people in rebuilding those lives. This phase 1 pathway of beginning with a Life Essentials program is also really important because during this time, we'll be able to determine whether or not this housing opportunity is the right fit for the individual and for the community. And this would happen before they've signed a lease for permanent housing. So every resident will sign a behavior contract that's built directly into the lease or occupancy agreement. And if they're unable to abide by the behavior contract, this will be an indication that they're not the right fit for this project. I want to note that we intend to run a very tight ship. We have heard the concerns of the community. We understand that this needs to be a very well-staffed, well-managed project. And because of that, there will be tenant support staff on site all day, every day, and a security guard at night. And this is in addition to the facility management staff who will live on site in an apartment. There's 56 units and there's also an on-site apartment in this building. I want to emphasize that this project, just as some of the previous speakers explained from the statistical level, but on the ground level, this project is needed in our community. They're seniors, they're veterans, they're small families living outside of a stable home in this county right now, tonight. They're living in their vehicles, they're in tents and shacks, they're in basements not meant for human habitation. Some of these individuals and parents are employed in local businesses. Some of them are living on Social Security income of less than $1,000 a month. And some of them have no income right now, but are willing and able to seek employment once they have the stability to do so. The theory is that if we provide them with a safe and secure place to live, they'll finally have the opportunity to rebuild their lives and become self-sufficient. But if we forego opportunities to house and support these people, the community problems caused by homelessness and the resulting personal human tragedies will only increase over time. So I want to pause and share a story of an individual who's on the top of our list as a potential resident of this new facility. I'm going to call her Paula, but that's not her name. And she is 72 years old. She was a single mother who raised a son who struggles with addiction, and the son lives out of state now. Paula used to own her own home here in Ukiah, but when her husband died 15 years ago, she fell behind on her mortgage and eventually lost the home to foreclosure. She has rheumatoid arthritis and osteoporosis, but excellent cognitive function. She earns $908 per month in Social Security retirement income. This is not an unusual income for somebody who might fall into this demographic. She's completely sober. She's never used drugs or alcohol in her life. But Paula's currently camping in her vehicle, tucked away near a highway overpass. She actually has a HUD permanent supportive housing voucher in hand already that would subsidize her housing, but she's not been able to find a place willing to rent to her. This is a real person. My teammates have spent time with her. She actually exists here in their community. We know where to find her out on the streets. And she's an ideal resident for Project Homekey. We're really looking forward to welcoming her into this building. So I want to close just with an overall vision for this project and what has been our guiding pathway and how to think about this. My team and I and our community partners throughout this community here, we believe that this project will change lives. The goal of the project is to provide a pathway to permanently recover from homelessness. It will be an opportunity for individuals and families to live in a safe environment while they recollect the pieces of their lives. They will have the sustainability they need to get a job, to stay sober after years of addiction, to escape from an abusive partner, to care for their own physical and emotional health, perhaps to join a church, to reconnect with family and friends, to provide a place for their kids to sleep in peace, and to contribute productively to the community they were raised in. So I'll stop there, and I'm looking forward to the questions and look forward to providing any other details that anybody wants to know about the project so far. Thank
Thank
you.
you so much, Megan Van Sant. We're going to just abbreviate her title. She's the project manager for all issues of the Best Western Project. We're going to be getting to your questions, your comments here in just a few moments. But before we do, we'd like to be able to hear from both the county CEO, Carmel Angelo, the city manager for the city of Ukiah, Sage San Giacomo. They're going to be talking about the county plans over the next few years. The Madam CEO is going to be speaking directly to this project. The city manager will be talking about other programs and housing within the city of Ukiah. Let's turn it over to the CEO for the County of Mendocino, Carmel Angelo, for a 5-minute briefing. Good evening.
Thank you, Senator McGuire. Thank you for your work and your support of our county. You are always there for us, whether it's a fire, whether it's a pandemic, or whether it's a homeless problem. So on behalf of Mendocino County, thank you very much. I also want to thank our city partners for being with us, Mayor Crane, and certainly our city manager, Sage San Giacomo, who will be speaking in a few minutes. I think that Megan Van Sant, our project manager, did a great job of explaining the concept of the permanent supportive housing that we plan on putting into the Best Western Hotel. You know, there's a lot of talk out there about all the services that Mendocino County provides, the number of beds that are out there, the number of homeless. But what we know is that there are more homeless than services that we have. We absolutely need additional services. Permanent supportive housing is one of those projects that actually can be a transition for people to really permanently get out of homelessness. And I believe that the example that Megan used is an example. There's more than one 72-year-old person.
Oh, Madam CEO, we got
Got it. Sorry. Somehow my laptop decided to mute. Anyway, so the point is that there are more people out there that need services than the services that we currently have. So we know that we've reached a point over the last decade, we've not been able to build out any of our services. We haven't had the funds. Mendocino County has had financial challenges. And how amazing that in the time of a pandemic, that we have federal and state dollars to actually build out services. And what I would really like to share today is the services that we're planning over the next few years. We have a couple different facilities and different funding streams that we're dealing with. So I think what's really good tonight is that we want to clarify the Best Western Project, and that is permanent supportive housing. It's not a shelter. It's not any other type of service. It's permanent supportive housing for homeless who can transition out of homelessness. And so that's what that program is. Along with that, we know that the people in Mendocino County voted in Measure B. That is mental health services, specifically for mental health patients, clients. And then we have another facility that we were fortunate to purchase over the last couple of months. And this facility is a skilled nursing facility that we are renovating, and it is in South Ukiah. And our goal with that facility is alcohol and drug services. And specifically what we would like to do is a medical model where we actually could provide a detox unit and then a residential unit. And our hope is that we could break this cycle and we could have in that facility women with their children. So what I'm describing to you is the services and this circle of life that we're looking at for Mendocino County that we can build out with the support and the help of the community over the next few years. Again, Best Western, we're looking at permanent transitional housing for homeless, our Measure B programs for mental health services, and then our program in South Ukiah that will be alcohol and drug services. This is the first time in my 14 years here that I can actually say to the public that we have resources. We've been able to buy buildings, not with general fund dollars, with money from the state and federal government. And this money is a bridge to help us provide more and better services here in Mendocino County. And, there's a lot of talk about, if we build it, we will have more and more homeless here. We'll have more and more people that need help. Now, I did some research over the last few days, and what I learned from our partners that are actually serving the very people that we're talking about is that approximately 80% of the homeless that we're currently serving right now were either born in Mendocino County or have lived in Mendocino County. So that's a little different, I think, than what the rumors are out there. We're not creating these services and bringing in more people. We're actually trying to serve the residents here in Mendocino County. So I hope that I've taken a few minutes and have explained the delineation of these services: medical model, alcohol and drug services, our Measure B, mental health services, and then of course the permanent supportive housing that Megan has talked about. Along with that, just to reiterate, as far as a management plan, we know that some of the concerns of the public that they have certainly verbalized over the last few weeks has been about what happens with this building. We have Best Western, we'll have people in and out, we will have a lot of problems, and we assure the public that that is not our goal. If you heard what Megan said, this permanent supportive housing will be a project that will demonstrate accountability for the people who live at the Best Western, and we hope to demonstrate accountability on behalf of the county as far as how we manage. And so we know that management of that project will be important, and management of the building afterwards will be important. So again, I'd like to just reiterate what Senator McGuire said. This is not the end of this process. This is the beginning. This is a kickoff for a community process that will begin. As much as Megan laid out the concept of our permanent supportive housing, there are lots of areas where we are asking for community input and want to work with the community and certainly with our city partners. At this point, I would like to turn it over to the city manager.
Hi, good evening. My name is Sage San Giacomo, City Manager for the City of Ukiah. Look, there's no easy solution to homelessness. We all know that. Project Homekey is just one component in many that are needed. CEO Angelo just outlined a few of the many other programs that are being implemented by the county to address this issue. In addition to addressing it through programs and services, we also need to improve our housing stock in the county. This is why the City Council has set policy to develop all types of housing in our community, from low and moderate to market rate, from single family to multifamily, and a number of different programs for tenant-based assistance for first-time home buyers and rental assistance. While the City of Ukiah is just one of 28 cities and counties out of 534 in the state that is currently meeting its housing production goals and is in compliance with our state housing element, we know it's not enough. And that's why you see the city and the county working to develop a number of additional housing units throughout our communities. In just the past 5 years, we've generated over 200. And even during COVID, both within the incorporated jurisdiction and outside of our city limits, you see hundreds of additional units that are currently in production right now. Our team at the city is engaged with the county and our community partners, and we are focused on solutions. We look forward to the 2x2 committee to elevate this collaboration between the city and county and look for many good things to come.
Mr. City Manager, thank you so much. That's City Manager Sage San Giacomo from the City of Ukiah. Thank you, Mr. City Manager. Please pass our thanks to the entire City Council as well. We want to say thank you to the County CEO, Carmel Angelo. Thank you so much, Madam CEO, for your words tonight. All right, we are now going to be getting into the most important part of this evening's town hall, and that is hearing from each and every one of you. Just a reminder, you got questions, comments, concerns, email us, senator.mcguire@senate.ca.gov, senator.mcguire@senate.ca.gov. If you want to use Zoom right now for your questions and comments, hit us up in the Q&A box. We're going to get to as many as possible. If you're on the County of Mendocino's Facebook page, please leave your comment there on the Facebook feed, and we're going to get to as many as your comments as well. All right, let's start moving. We're going to go into questions or comments. This first one is going to be directly to the CEO and to Ms. Van Sant, the project manager. These two questions are coming in from Karen. Karen asks, number one, how long are the residents allowed to stay there at the Best Western? Number two, what are the rules/guidelines that must be followed while staying at the Best Western? Madam CEO, Ms. Van Sant, who would like to go and take this question?
Let me just open it up and then I'll turn it over to our resident expert here, Megan. I would say that Megan certainly is the expert on what the requirements and the regulations are and also the time frame. But for those areas that are gray, we know that the community does have some expectations of the county with this project, and we're very flexible with those gray areas. And with that, I'd like to turn it over to Megan to answer the core questions here.
Thank you. So I think the first question was about how long can people stay in the building? So we're purposely designing this building to have fairly extreme flexibility. We will have kitchenettes in as many units as we can get kitchenettes into them as possible. And the reason that kitchenette is important is that enables that unit to be to accept a housing voucher for permanent housing. It's the kitchenette part that makes it able to be permanent housing. But it can also be used as transitional housing. So the pathway for somebody through this building, in my mind, could vary tremendously. Somebody may be in this building for 4 months, 5 months, and they're really able to get on their feet. Maybe they have a small family. It's not really a place for them to be for a long period of time, and they get to move into one of the low-income housing units that City Manager San Giacomo described, some of the units that are being built right now. So some people may be in this building for a couple months, up to 6 months. Other people may be in this building for several years. If you're a senior, if you're a single individual, for some people, this unit, 300 square feet with a kitchenette, will be where they will be maybe until they die, depending, this could be permanent housing, meaning they're there for many, many years. So what's exciting about this project is it's very flexible in that way. It's not boxed in. It can meet the needs of the residents. It can meet the needs of the community, and they will be able to be in that building until they move to another permanent location. So that was a vague answer, but there aren't requirements in that sense in terms of length of time to stay.
So Ms.
Which
Van
makes
Sant,
it really exciting.
thank you. The second question coming in from Karen is, what are the rules/guidelines that must be followed while staying there? Ms. Van Sant, I think that's part of the public process too, right? That you're going to want to be able to better public input to be able to understand where the community is at and what they want to see with rules. But give us some of the general rules and guidelines that folks will most likely have to follow while staying at the Best Western.
Right. Well, obviously, illegal drug use would be a lease violation. Using on the property or nearby the property would be a problem. That would be a behavior contract. But that's just kind of like trying to figure out how to explain that. That's an obvious one. We're also expecting behavior expectations so that your behavior in this building is not negatively impacting any of your neighbors. This is a community building, and people who are not able to live in community, as we say, would not be able to stay in this building because it wouldn't be the appropriate place for them. We're planning on having a pretty strict guest policy. I think earlier somebody referenced, how do you prevent people having a lot of people over? That's not going to be allowed. There will be a guest where you need to sign in your guests, and you have pre-approved guests. We're going to run as tight a ship as possible with this behavior contract. I can't read you exactly what it is going to say right now. We're looking at a lot of different models. We've used behavior contracts ourselves in different housing programs that we've run, including Project Homekey, and they're very effective. They're effective because they explain to the client what behavior is expected of them. They know, and they know whether it's going to be a fit for them too. And it helps us go back to that client and say, this is the agreement you signed, and you're not following your agreement here. So there's going to be consequences. And that's the way it is. This is not, this is a government funded community project in the middle of a community. People need to be able to live effectively in that building and not negatively impact their neighbors.
Thank you, Ms. Van Sant. We're going to stay with Ms. Van Sant. She is overseeing this project for the County of Mendocino. She's within the Health and Human Services Agency at the county. Ms. Van Sant, we're getting a lot of questions about management. So let's talk about that, because I think you're going to have two levels of management on site. I know you covered it in your remarks, but it's a really important point. So you're going to have on-site management like for fixing toilets and showers, et cetera. But then you're also going to have, most likely, a nonprofit manager working with all the residents there. So go in depth on what management may look like there at the Best Western.
So you're exactly right. The vision right now is that there's a facility management contract. That's the, I don't know if we're going to call it facility management or property management, but that's the fixing the toilets, accepting the rent, that organization will also have an on-site person living in the apartment. So that's the building people who are responsible for the building stuff, which is not my area of expertise. So I'm really glad there'll be somebody else running the building part. The tenant support staff will be providing that support to residents, maintaining expectations for the residents, giving that feedback. They will be on site. Right now, we're hoping from like 8 a.m. to 10 p.m., something like that. And there will also be a security guard at night. So that is your person that is there, understands this population, wants to support this population, keeping in very close contact with my team. My team's really hands-on. So the tenant support staff will be working directly with us to facilitate the connections that residents need in order to move along with their life essentials plan, to move along with maybe moving towards a different permanent housing resident location as well.
Thank you, Ms. Van Sant. So Ms. Van Sant's talking about 2 levels of management. One, to be able to take care of, if you will, the basic needs of the units, making sure that needs are addressed. And then the other management will be a nonprofit working directly with residents. So I want to get to Mark's question, Ms. Van Sant. So he was just asking what professionals will be managing the Project Homekey projects to be able to meet the psychological and physical needs of the tenant. And then I'm going to go a step deeper on that. So I'm going to have you cover how will psychological and physical needs be addressed if tenants need them, number one. And then number two, what's the process that the county is going to have to go through to bring on management, nonprofit management for that site? So why don't you deal with, if you don't mind, Ms. Van Sant,
the first part,
the physical and the psychological needs. How does that work with this project?
I think that's a really good question, and I probably could have explained that better when I first was explaining. I want to really emphasize how intentional this project design was, so that the individuals that are moving into this building will already be part of some sort of case management. That is very intentional. So if you're enrolled in our whole person care program, for example, you already have a wellness coach, you already have a care manager, you're already plugged into that system. So those, if you are, let's say, a referral from Adventist Health, because you're a person with, maybe you're being released from the hospital after surgery, not able to heal out on the streets, that hospital has case managers, they have nurses that will be responsible for that person's medical health. So each person that's going to be moving into this building by design is coming with a program already attached to them. If you're involved in the CalWORK housing support program, this is not necessarily the medical and emotional wellness needs, but if you're involved in CalWORK's housing support, you have an eligibility specialist who is making sure that you meet your goals to continue to stay in that program. So I guess my answer is that the people on site will not be specifically involved in that level of detail for each resident of that building, but we purposely designed this building to have residents that come with care managers attached. If you're a veteran and you're enrolled in the veteran supportive housing program, you have a highly skilled social worker already assigned to you.
So Ms. Van Sant, it would be fair to say, if I am going to go live at the Best Western Project, there will be case management, if you will, attached to me, my unit, for any support that I may need. Is that a fair statement?
It's a fair statement to say you, Mike, will arrive with that already in place. That's part of our tenant selection process. Let me just do one little caveat here. There are some individuals that don't have a high level of need. Paula, who I just described earlier, she's simply elderly. She doesn't actually need a lot of support. She needs a place to live. So there are definitely going to be people who only need a place to live. They're not suffering from severe mental illness. They're not addicts. They're not suffering from addiction or recovering from addiction. They just need a place to live.
I appreciate that. Thank you. 30 seconds, Ms. Van Sant. Describe how the county is going to bring on a nonprofit manager for the site. What does that process look like?
I'm going to defer to CEO Angelo on that, but I do want to know that we are in this moment of a public health emergency, so it does allow the county different kinds of flexibilities we don't normally have, but I'm going to let CEO Angelo answer that if that's okay with you.
Sounds great.
Sure. Very briefly, we would do our government purchasing and contracting process. So we would go out, we would do a request for proposal, request for bid, and get a contractor in there for management. So, but what Megan is saying is because we are in a local emergency, it's possible that some of the timelines and the regulations could be moved. But the point is that we will go for the best service that we can as far as managing the facility. And I think that's probably a key issue for some of the members of the public.
And just to piggyback on that, you know, as Mr. Ross explained, the timelines are extremely tight that the county needs to. We're supposed to have people move into this building in February, and normal government processes to do a full RFP take longer. So I don't know exactly how it's going to look, but we could end up with an interim contract while we're going through the RFP process. So.
And I think, Senator, just one more thing, because there may still be some confusion. Case management, Megan's talking about case management. That's different than management. Just for the members of the public, it's different than the management of the building, I think is what the public is concerned about. The case management is programmatic. We've got that, but the actual physical plant, the management of the building, that's something that we would go out for bid on and get the best vendor we can.
Thank you so much. And Madam CEO, I think it would be fair in probably the next town hall, you'll be doing a little bit of a deeper dive on management. I'll say the two silos of management, physical building management and case management for employees. Would that be fair to say, doing a deeper dive?
Yes, absolutely. Yeah.
Thank you. All right, we want to go to a comment and a question coming in from Martha tonight. Martha wants to express opposition to the counties moving forward with the selection of the Best Western on Orchard. It's simply the wrong place to put this facility. The program as planned doesn't meet the CARES Act prerequisite of a low barrier, equity selection, and there are good alternatives, which I would be glad to discuss. And the question is going to go to Megan, and we'll also have the CEO, Madam CEO, have you chime in on this in the beginning here. Megan, in reviewing the CARES Act criteria, it prescribes low barrier, in quotes, with no requirement for any type of requirement. I don't believe your program meets these criteria. Your program is discriminatory. Now, I just want to be clear, the county is very much focused on the requirements that the state has set forward. And you are living within those means, not going beyond them. But I wanted to turn it over to Madam CEO. Madam CEO, do you want to kick us off on this issue? And then we'll turn it over to Ms. Van Sant. Thank
you. Well, if I'm understanding Martha's question, talking about the location, and I believe that's the key issue, that this was not the proper location.
Well, she's actually, right? In reviewing the CARES Act criteria, it prescribes, quote, low barrier with no requirement for any kind of requirement. She does not believe the program meets the criteria, and she believes the program is discriminatory.
So you know, I would actually like to follow up with Martha and find out a little bit more. I don't believe the program is discriminatory. I believe that we meet all the requirements with this particular facility and location. So, you know, without having that one-on-one, I'm not quite sure what exactly she's referring to, but I know that we have done, when you talk about a deep dive, Senator, we certainly looked at what the requirements were and actually worked with the state. The state actually was here and worked with us. They actually worked with us on the facility. We had 3 facilities we were looking at. We looked at all the requirements of the money. So I'm not quite sure what those issues are, but I would gladly follow up with Martha to find out so I could give her a better answer.
That's great. And she said she'd love to discuss with you as well. Thank you, Madam CEO. I want to go to Mr. Ross. Mr. Ross, 60 seconds or less on behalf of HCD, Housing and Community Development. It's the state agency that oversees Project Homekey. Do you want to just talk about the requirements really quickly and any communication that you've had with Mendocino County, please? Mr. Ross.
Absolutely. No, I appreciate that. And I appreciate the CEO noting that our Department of General Services was up helping to identify the site and looking at all the different things that needed to be accounted for to make sure it was a good location and a good facility to house very vulnerable folks. From a fair housing perspective, we're always very cognizant to make sure that we are making sure that the project is truly accessible to anyone in need based on the priorities that are set forth in the program. In our conversations with the county, we know that It's a very flexible site looking at trying to serve a wide variety of folks. I think the key is that we're looking at leases that are going to be entered into. Those leases have to meet all fair housing standards. Everything that we've heard, my staff, myself tonight, is not anything in violation of what I understand is the intent of the county in this moment. But it's one of those things that certainly if there's a question, the state remains available to help and to make sure that we continue our partnership with the county and the city.
All right, thank you so much. That's Jeffrey Ross. He oversees Project Homekey for Housing and Community Development. Ladies and gentlemen, we're going to move on to our next question. We're going to go to Ms. Van Sant on this. Anon asks, will this facility be limited to residents of Mendocino County? That's number one of his question. Number two, how do we prevent an influx of those who may be addicted from out of county? So again, I'm going to use the statistic that was advanced by the CEO earlier. 80%, and please correct me if I'm wrong, Madam CEO, 80% of those who are homeless on the streets of Mendocino County have been residents in Mendocino County or actually born in Mendocino County. Madam CEO, is that a correct statement, please?
Yes, Senator, that is.
All right, thank you so much. So talk, Ms. Van Sant, about will the facility be limited to residents in Mendocino County, and is there a way to prevent influx of folks who are addicted from out of county? I don't think that's going to happen, but I'll turn it over to Ms. Van Sant to give us the truth.
So this is a question that comes up over and over again, and I think I appreciate that CEO Angelo is sharing the statistic that the vast majority of people that we work with are Mendocino County residents, are from Mendocino County, and have lived here a long time. So it is discriminatory and against the law using that to restrict tenancy just solely based on whether you're a Mendocino County resident or not. So, but there's a couple ways that I can think of answering this. For one angle, there's just not as many people in the public think of drifters who come to this community just to find housing. That just doesn't happen as frequently as people think. Secondly, the referral process will include we are going to be accepting referrals from community-based organizations who have relationships with individuals. It makes it much less likely that they're transients moving through our community and not, local residents who've established a life here. And I'll just also say, if somebody's traveling through the community and they don't have deep ties in Mendocino County, their ability to recover from homelessness is going to be much more effective in their home community. So we're always interested and helping homeless individuals who come into this community who are much more likely to recover from homelessness, where they have friends and family and roots, helping them to get back to that place. As an example, just today, I was talking with a community-based provider who was working on helping somebody who was staying at our shelter return to Montana. That's where their friends and family were. We are happy to help somebody move back to Montana where they can live with their friends and family and rebuild their lives there. But I also just want to add one more thing, because it's pretty important. When we were having this conversation with community-based partners, and it was several months ago, and our local Veterans Affairs Administration housing person who was there said, we have veterans in Mendocino County that are welcomed into facilities in Sonoma County. And we have veterans that we place in Lake County all the time. And if we create such a closed system here that we don't ever allow anybody from other parts of the community to live here, those same kind of reciprocal relationships could end. And I think it's really important to note that this is not a cut and dry. If you live here, you get services. If you don't, you're kicked out. It's much more fluid than that. And it's just not as big of an issue as many people in the community think.
I appreciate that. That's Ms. Van Sant, project manager for the County of Mendocino, overseeing the Best Western Project. I want to do a quick time check for all of those who are with us. We want to say thank you. We have about 100 folks here on Zoom. We have many more watching on YouTube and Facebook. We want to say thank you for hanging with us tonight. If it's all right with each of our panelists, would like to be able to go for another 20 minutes to about 8 o'clock. We got a lot of questions coming in. Thumbs up from panelists. Does that work for everybody? All right, we got thumbs up. There we go. Let's keep it going. If you'd like to be able to ask your question, we have questions coming in fast and furious. Senator.mcguire@senate.ca.gov. Email us your questions. Senator.mcguire@senate.ca.gov. If you're with us here on Zoom, hit us up in the Q&A section of your screen at the very bottom of your screen. Hit that Q&A box up, put your question, your comment in there, and we'll get to you. I'm going to ask our panelists if it's all right. We got a lot of questions coming in. I know we have a lot to say tonight. If it's all right to get as many questions as possible, 60 seconds, no more than 90-second responses, just so we can get to as many questions. And again, so grateful to our panelists for answering, but let's keep it going here. This is going to go to City Manager San Giacomo, Sage San Giacomo. This next question is coming in. Why doesn't Ukiah have an active Habitat for Humanity program to build housing? Fort Bragg built some units, but it doesn't appear that it's currently active in Ukiah. Mr. San Giacomo.
Yeah, sure. We have in the past, and it's currently not active now, but we do have alternatives. RCHDC is doing self-built housing and has been doing self-built housing in our community for a number of years now. And currently there's housing that's being built near the Lake Mendocino area, and that is self-built housing similar to Habitat for Humanity. So we do have active programs like that that are currently in process in Mendocino County now.
Okay, thank you so much. That's Sage San Giacomo talking about Habitat for Humanity in the city of Ukiah. We're going to go to a comment and a question from Carol. Carol writes in tonight. Again, I want to go to Ms. Van Sant, and I'm going to have you reiterate this. We're still getting a lot of questions. One of the most popular questions tonight: will the county mandate that professional staff and security be on site for 24/7 at the Best Western? Ms. Van Sant, I'm going to ask you to, if you don't mind, keep it quick. But bottom line, security and professional staff 24/7, yes or no?
Yes.
All right. So 24/7, you're going to have an individual who's literally going to live on site, a manager, plus you're going to have security, correct?
Correct.
All right. So that's an easy one. Ms. Van Sant, thank you. There we go. All right. We're going to go to Carol's comment now. County, can you please mandate a little bit of a different subject than Best Western, but talking about RCS? Would the county please mandate RCS hosts bi-monthly public forums with community management facility and the heads of RCS to be able to discuss community impacts and collaborate on potential solutions? We'll go to CEO Angelo and then Ms. Van Sant. Madam CEO.
Okay, so I believe that she's asking about Redwood Community Services doing community meetings, and certainly we have a good working relationship with RCS, and they're definitely supportive of the community and working with the community. I don't think it would be a problem. We certainly can follow up with Camille Schrader and the other team at RCS and talk to them about community meetings. Did I answer that? Was that the question?
Yeah, the question was she was hopeful that there could be bi-monthly public forums, community meetings with management in the community on that. And the CEO go ahead.
Yes. The only thing is, I guess, RCS provides so many services. So, it may be something that we'd have to drill down a little bit and find out exactly what she's referring to. But it's not uncommon for any of our contractors to do community meetings. And what would be, I think, well received and would work well would be a joint meeting of the county and RCS regarding our services. So I think it's a great idea.
That's great. So if Carol, if you are still watching tonight, contact the county executive's office to follow up on that, right? County executive?
Yes. 707-463-4441 is the executive office number. And we'll talk and we'll see what we can do to schedule a meeting. So thank you.
Thank you so much. This next question comes in from Justine. We're going to go to Ms. Van Sant. Ms. Van Sant, you've talked about it, but again, we have some very common themes here. Justine asks, will applicants for housing at the former Best Western be required to be clean and sober before qualifying?
So we will not require drug testing in order to be a resident of this building. There is sober living, and we have some excellent sober living facilities in our community that do require sobriety in order to live in that building, but that's not a requirement we're allowed to impose through the Housing First model. However, your behavior has to be such that you can live in community. So if you are somebody who is deep in your addiction and you're not able to live in community in a way that is not disruptive to everybody else, you're not going to be a fit for this building.
Thank you so much. Straight talk from Ms. Van Sant. We are now going to go to the CEO. Madam CEO, another question comes in, and we're going to go to the city manager and have him comment on this as well. I assume the 2x2 committee, as it gets going, right? It has not been started, but it's leadership by both the county board of supervisors, the city council that wants to establish this. Then you will also collaborate with the Mendocino Continuum of Care on this issue as well, right? With the 2x2, I assume, but we'll go to the CEO and then the city manager.
Yep. The answer is yes, absolutely. That would be my answer. No problem there.
Thank you.
Yeah, and I'll just echo yes. In fact, those pieces are already in place. Our leadership, both council and board of supervisor and city and county staff are all working in collaboration with the Continuum of Care currently. So that linkage is already there.
That's great. Thank you, Mr. City Manager Sage Giacomo from the city of Ukiah. We're taking your questions right now, senator.mcguire@senate.ca.gov. You can also put your questions, your comments, your criticisms into the Q&A box here on Zoom. We're going to go to Paul Fordham. Paul Fordham is the Deputy Executive Director from Homeward Bound. The question was directed to me, and I think you're going to have a better answer than I. So the question is, do I really think that these people will go to college and get a job? And I assume it's because what I said is that community college, Mendocino College, is receiving $1 million to be able to expand their construction core program. Actually, I do. If you take a look at those who are entering the construction core program, they're re-entry students. And in fact, there are students who were previously homeless that are going into the construction core program, which is critical. Do I think that every student is going to go get their certificate? Absolutely not. But then there are other ways to be able to get jobs, and that's where Paul Fordham comes in. Paul Fordham is the Deputy Executive Director of Homeward Bound. So, Mr. Fordham, folks are homeless. They're coming off the street, and I'm just going to give an example. Let's just say that they've been challenged with some type of addiction issues. They're getting clean and sober. What next? How do you connect them with jobs? Because that's your whole goal as a nonprofit manager for a site like this, is to be able to get folks to start their life over and get a job. So talk about that, Mr. Fordham, how that works.
Yeah, I mean, first off, I'd say before you have a program like this and you're homeless, every day you're trying to figure out where are you going to sleep and where are you going to eat. So any future planning is very, very difficult. Once we're able to provide some stability, whether it's a short-term stay in a program like this or something longer, folks can then start looking beyond the day-to-day survival and planning out what is next. And folks have said to me before, I see people sit on the side of the road, I see people driving past in their cars. I can't imagine how to get my life back to there because I just don't know where to start. Having a roof over somebody's head is the first step in helping them re-enter society. And I can give you direct examples with what we do at Homeward Bound. We have 32 studios that are dedicated only for people who have been formerly homeless, have been in the shelter and on the street, and are returning to work. It's the only way you can qualify to get into the housing. And normally it means going to school to get a skill and then go to work, or it can be getting a job at somewhere like Pete's or Starbucks on the training path to get a job. So there are many different avenues, but absolutely we see people re-enter jobs in the culinary field, in the service industry, but we also see people go back to in Marin to the College of Marin to do certified nursing assistant training. We see people go to the auto mechanics course and become smog technicians and things like that. These are all folks who are formerly homeless, many of whom have struggled with addiction, but you create a framework around this is how you move your life forward. This is what's worked for others in your scenario who've been homeless and needed to start again. Community college is a great way to go because there's a lot of focus on the industries, the technical skills that we don't teach in schools anymore. And it's a great pathway for folks. And often they can get paid while they're going to school. So folks take that route. So yeah, is it for everybody? Absolutely not. But I'd say a large percentage of the folks that we see do return to work. And the one other caveat I'd say is there's some people with fairly severe mental health issues who we've been able to house. And over time, they don't want to stay at home in that unit all the time. They need something meaningful in their lives now that they are housed. So we've seen people really become productive members of our kitchen teams, where they are mostly reliable employees, and sometimes they're cleaning the kitchen, they're on the cleaning crew, but they show up every day because they appreciate like having a more meaningful role, being a part of something bigger again. So yes, many folks will return to work. I can guarantee it. We see it all the time.
That's Paul Fordham, Deputy Executive Director for Homeward Bound. Thank you so much. Talking about, while it may not seem like it, or there may be a stigma that folks simply don't want to work or won't go to work, would you say the majority that you are working with, Mr. Fordham, will eventually go back and get a job?
Yeah, I'd say there's at least 50% will do that, and maybe more. And the other thing I would say is we really encourage it. Even if you're not working, you're volunteering, so that it's the people you know. Obviously, COVID has changed things a little bit, but it's the meaningful daily interactions. How do you reintegrate back into society again? So sometimes folks aren't ready to work, but they want to volunteer at the Humane Society to walk animals. And it's that connection with the animal, and then the connection with other volunteers and the people they meet on the bus, all part of that is normalizing life again. So yeah, we see a huge percentage of people who return to work or re-engage with the community.
All right. Thank you so much, Paul Fordham. We're taking your questions at senator.mcguire@senate.ca.gov. We're now going to go to the city manager first and then go to the Madam County Executive Officer. Mr. City Manager, this is coming in from Matthew at KMUD. Matthew is asking, what sort of collaboration has occurred between the Ukiah Police Department and the Mendocino County Sheriff's Office in maintaining the security of the site? I assume means Best Western, but Mr. City Manager, do you want to talk about the Ukiah Police Department's collaboration, coordination with the Sheriff's Office? Then we'll go to Madam County Executive Officer. Mr. City Manager.
Yeah, I mean, the Sheriff Department and Ukiah Police Department collaborate on a number of different programs and services for our communities. We just last week actually met with Megan and her team, a multidisciplinary team from the city of Ukiah that included our city planning team, our police department, and the city manager's office to cover a number of the topics that we're discussing here tonight. And I have to say that Megan and her team in developing the RFPs for the project from both the service side and also the maintenance side of the house are incorporating all of this input from these community meetings and from meetings with stakeholders like the city of Ukiah into the contracts and the programs, the program documents for this facility. And our police department from the meeting last week felt very confident in the program that was being developed by Megan's team in providing for a successful operation. And I think as many people hear the stories that we're hearing tonight and how it's going to be operated, a lot of the concerns are hopefully going to be addressed. But I know keep them coming in because her team wants to hear that. And ultimately those will lead to better contractual documents and operating procedures for the facility.
That's City Manager San Giacomo from the city of Ukiah. Let's go to Madam County Executive Officer for County of Mendocino.
Thank you, Senator. Crime has no boundaries. With our police departments and our sheriff's office, they do mutual aid all the time. It's not uncommon for the deputies to back up the police and respond, and it's not uncommon for the police to back up the deputies. So I don't think there's any issue there. I think there is a concern that we've certainly heard from some calls and some emails that have come to the Board of Supervisors regarding crime, how this Best Western project will impact the city of Ukiah PD and the surrounding areas. And I would think that the people that will be at Best Western are vulnerable. So we will be taking vulnerable people off the street and putting them in supportive housing, and it should actually help reduce the crime that we would find on the streets with some of our homeless population. That is a hope that we have. Thank you.
Thank you so much. Quick comment coming in from Jen tonight. Jen says, kudos to the state, county, and city for taking real action to house our community's residents. We're now going to go to Jacqueline. Jacqueline is writing in for El Punto Spanish newspaper. This one is going to Ms. Van Sant. Ms. Van Sant, Jacqueline asks, would you have a native Spanish speaker in your staff to support Spanish homeless residents?
Yes. My team, so I work with an advocacy and collaboration team, and it has always been critical that we have Spanish speakers on staff. We will continue to have that. We still do have Spanish speakers on staff, and they will be the primary person for any Spanish speaker who needs help facilitating access to this building or working through this project. So the short answer is yes.
Thank you so much. Ms. Van Sant, we are rolling with the lightning round. So we have about 5 minutes left. We're going to ask each panelist to try to get to the answer in 30 seconds. We got a lot of questions still coming in right now. This next one is from Ms. Van Sant. It's coming in from Josephina. What will happen to the people currently being housed at Bridges in South Ukiah? Will they be the first ones moving into the Best Western? I mean, they're the homeless with most immediate need. Will they be placed in the South State Nursery Building? What will happen to them? Ms. Van Sant.
I'm assuming that Josefina is referring to building bridges, and the answer is no, we're not going to prioritize that way. We have many people living on the streets who are not residents of building bridges, but they certainly would be open to the whole referral and tenant selection process, just like any other homeless individual or organization serving homeless individuals.
Thank you. We're getting a lot of comments and questions tonight about the importance about expanded mental health programs. A lot of folks writing in tonight about working on mental illness in Mendocino or expanding programs. So Ms. Van Sant, again, I want to hit this hard tonight. 30 seconds, if you don't mind. Talk about if I am a potential resident and I am not hooked up to any programs and I have mental health challenges, will I be able to access mental health services if I live at the Best Western? Ms. Van Sant.
Yes. I mean, I'm sorry, I know you want me to be fast, but that was a complicated question.
Go right ahead.
Okay, so one of the many pieces of beauty about this project is that the tenant support staff have access to a very easy access to county services and county programs. So if there was a resident in the building who needed access to emotional support through mental health services and was not already connected to them, the ability to link them to mental health services support either through the mild to moderate path or the severe mental illness path will be facilitated by our team. It would not be a difficult thing to accomplish.
And Senator, if I could add a comment with that as well. When I spoke, I delineated the 3 different projects, right? The Measure B projects, which are mental health services, the South Ukiah Whitmore Lane, which are alcohol and drug services, and then Best Western, which is supportive housing for homeless. Those are 3 different projects, 3 different areas of service. The intersection of that service could be someone who lives at Best Western but gets their services either from a Measure B program or from Whitmore Lane or from both. So, you know, that is the beauty of trying to build out this continuum of service here in Mendocino County. Thank you.
Thank you so much. Very grateful. That's CEO Carmel Angelo. Here we go, Ms. Van Sant. We have a couple more for you. James asks, can anyone expand on the financial picture after the 2 years of state subsidy? What do you believe is going to be the annual cost to maintain the units, and where will that money come from? Ms. Van Sant, again, individuals who are going to live at this development will need to have some type of income attached to that unit. Go into that, and that's really how you're going to help pay for this as well. Ms. Van Sant, the floor is yours.
So again, that's exactly correct. The vast majority of the units, the person who's living in that will be eligible for and receiving some sort of housing, subsidized housing voucher that will pay for the fair market rent of the unit, which is going to be roughly $1,000 per month. Those vouchers may be a Housing Plus housing choice voucher, it may be a permanent supportive housing voucher, it may be a Veterans Affairs supportive housing voucher, it may be through the CalWorks housing support program. I just want to make clear one thing to the community though. We have veterans whose veterans benefits are actually quite substantial, but they have not been able to live independently without support. Some of those veterans will be paying the full rent themselves. Some of the families that we place in this building will be actually paying the full rent themselves. So it's going to be marrying people in need of affordable housing and sometimes people that just need housing at all while they're waiting for maybe a senior housing unit to become available or something like that. So it'll be a variety of ways that funding will come through it, but it will be $1,000 per month per unit, roughly.
Thank you, Megan Van Sant from the County of Mendocino. We're going to go to Emily. Emily has a twofer. Emily says, I'm supportive of this type of project. One of my questions is, how many people will this actually support? I understand from local news articles, and we want to say thank you to Ukiah Daily Journal for asking questions tonight. She understands from local news articles that some of the existing units may be combined to accommodate families. So at the end of the day, Ms. Van Sant, how many units, ballpark at this point, I know, how many units do you think will be available at the Best Western?
52, because 4 of them have adjoining rooms, and I'd like to reserve those for families. However, so four units would become, there's the adjoining rooms. I anticipate that over the decade, hundreds and hundreds of people will have a path to permanent housing through this project.
There was a comment made tonight that this is not the silver bullet. There's going to need to be work done. We have a lot of challenges in front of us. So I'm going to look to the city manager on this as well. What other similar projects are in the works, if any? This is the second part of Emily's question. What about the risks that are, what about the at-risk that are not good candidates? So let's talk about other projects that are in the works. I think that's something that the 2x2 is also going to help identify. But Mr. City Manager, do you want to jump in on this, and then we'll go to the CEO and Ms. Van Sant. Mr. City Manager.
Yeah, I'll let the CEO talk about the other at-risk programs that are in place on housing. But for other low market and market rate housing that's taking place, again, this is just one component in freeing up the housing stock in Ukiah. Because there was so much need and low supply, everything got jammed up, and there wasn't enough movement through the housing stock to allow people to effectively go through. So we end up with individuals that are in multifamily housing complexes that can't move to single family housing because we're not building enough single family housing. And certainly that means that impact on the demand side, rents raise. And it makes it harder and harder for people that have that are lower income or moderate income to be able to afford even a rental, when we have many people that are paying rent in excess of what others are paying in mortgage. And so we need to free up and this jam, this log jam. And this is one component to freeing up that log jam. It's just it's one piece, and there's many other pieces that help all socioeconomic demographics in our community get housing. And so we're working at the city of Ukiah to build more single family and multi-family units, and I know the county is working on that end, as well as programs that are from the very basics to emergency shelters to other transitional housing programs.
Thank you, Mr. City Manager. Madam CEO.
Okay, very briefly, first of all, I think the city of Ukiah has done a great job as far as the housing that they continue to build. And within the county of Mendocino, if you talk about market rate housing, we are hopeful that our 2 housing projects that have gotten off to a slow start will actually develop at some point. So we're still hopeful with that. As far as our services, we know that with our Measure B dollars, that was a vote of the people, that we will have a crisis residential treatment program that we're building, and we're still looking at a 24-hour inpatient psychiatric facility. I want to say the program that I think is key is the alcohol and drug program that we're very hopeful that we will have built within the next 2 years. And then, of course, our supportive housing. So we've talked about this, and I realize I am repeating myself, but these are key programs. And if we can get these programs built within the next couple years, we will have a continuum in this county that we have never, ever had.
Thank you, Madam CEO of Mendocino County, CEO Angelo. All right, we have 4 or 5 final questions. We have gotten through a lot of your questions. We want to say thank you. We're going to need to wrap up. We're over time. We're at about 8:04. Thank you for hanging with us. Thank you to our panelists. Here we go. Jessica asks Megan, will you be using VI SPDAT? Yes, that's for veterans, but please, Megan, explain those vouchers, VI SPDAT.
That's not exactly what VI SPDAT is. The VI SPDAT's a measurement to understand how vulnerable and how chronically homeless a person is. The short answer is maybe for some of those units. Sorry, I don't have anything more specific than that on that.
Councilman Orozco from the Ukiah City Council writes in, there are plenty unhoused persons that refuse to use the services. Are there any plans to offer some type of carrot to make it hard to refuse the service to the unhoused that rather not take you up on their offer? Ms. Van Sant.
That's a very, very hard question, and I don't have an easy answer for that. I think if from my experience, people who are living on the streets and unable to accept any help for whatever reason, that's a very difficult challenge. I think that the solution is going to involve creative, symbiotic, really carefully crafted relationship with law enforcement and service providers in order to reach those people.
Thank you so much. We have 3 last questions. Then we're going to go to closing comments from the mayor and the board of supervisors chair. This comes in from Buffy. Buffy is asking, has anyone contacted the Northern Circle Indian Housing Authority? Buffy was saying that trying to get tribal leaders involved in this process. Madam CEO or Ms. Van Sant, do you want to answer that from Buffy?
I personally have not, but I'm going to refer to Megan.
I recently had a workshop with community-based providers who really encouraged us to include tribal entities in the referral process and in the tenant selection process, and I'm absolutely going to reach out to those entities to do that.
Thank you so much. Michael asks, this is our second to last question, is the county using the homeless management information system?
Yes.
You want to just explain what that is, Megan? Megan is being, she's trying to
be real fast.
I'm very grateful, Megan, for that. We've just been trying to burn through as many questions as possible. It's really critical that we get as many questions answered. Ms. Van Sant, you have been wonderful about this. Thank you. Please, the floor is yours.
Yeah, I feel like I'm on a super weird game show, but I'm just going with it. So, so the Homeless Management Information System, it's often called HMIS. It's a kind of registry of sorts. It's a system that keeps track of homeless people and the services provided. And yes, this project will use HMIS.
All right, thank you so much. Final question, and this really is an important one because we've seen folks who have pets who don't want to go to evacuation shelters. We see folks who have pets that would rather sleep outside in the freezing cold if they can't bring their pets in. So will residents be able to bring their pets to the Best Western site? That's coming in from Ann.
So if you have a service animal, yes. And I have to be totally honest, there's something called the Pet Friendly Act of something that we're required to comply with. And I haven't looked up what that means yet. So I don't know the answer to that question yet. And I'm just being honest. I'm not totally sure whether we're required to allow pets or not. We will figure that out.
No, I appreciate that. Mr. Ross, any challenges with having pets coming in? Mr. Ross is from Housing and Community Development. My understanding is other developments are allowing pets, but please fire away on this one.
No, certainly, and I think Megan's answer in the moment is correct. That anytime you have a service animal, absolutely that service animal needs to be allowed. But then there are other considerations, and so I think making sure that you fully explore what you need to be able to do is the appropriate measure in this moment. And I think that as part of this, you're still designing the program, and so that is also some units you might reserve for pets, some units you might say no because then there's allergy considerations and other things that go in. So I think it's the totality of that planning and that vision that you're working through, and I have full confidence that the program's going to respond appropriately.
All right. Just want to say thank you. Thank you to all of you who have tuned in tonight. You have been amazing. This is just the start. This is not the end. This is the start of a robust public process that will be led by the County of Mendocino, focusing on the Best Western project, taking your input and shaping what that project will actually be, regarding the management, regarding the population. Will there be pets? Will there not be pets? You name it, they want your input. So this is just the start of the public input process on this critical project. I want to turn it over to Mayor Crane to see if Mayor Crane would like to be able to give any closing comments. Then we're going to go to the Board of Supervisors Chair, John Haschek. Mayor Crane, the floor is yours, sir.
I would say this evening has been a good start, that this project holds much promise. And it's important that as it evolves, it performs along the rules that are established and the promises that are made and the projections that are put out in these meetings so that we maintain credibility and achieve the desired goal of providing housing, and it is sorely needed. Thank you.
Mayor Crane, thank you so much. Can you please pass on our thanks to the entire City Council for being part of this process tonight? We're very grateful for your work, sir, over the past many, many years. Thank you, Mayor Crane.
Thank you.
Let's turn it over to John Haschak. John Haschak is the chair of the Board of Supervisors for Mendocino County. Mr. Haschak, closing comments, please.
Well, thank you, Senator McGuire. And I think this was a very productive evening. And it certainly is a start to the communication that needs to happen to make this project a success. And that's what the county is committed to, is making it a success for the city of Ukiah and the county of Mendocino. So thank you again.
That's Supervisor Haschak, chair of the Mendocino County Board of Supervisors. Again, what our goals were for tonight is not to be able to advance a marketing ploy. Our goal was tonight was to talk about the facts related to the Best Western Project. We wanted to be able to give you that deep dive related to the Best Western Project, how we got here, why it was needed, and where we would like to go with you, with your input. And that's going to be absolutely critical. So let's talk about what the follow-up is going to be from this first town hall. Number one, thanks to the leadership of the Board of Supervisors and the Ukiah City Council, a 2x2 collaborative ad hoc committee is going to be established, talking about the holistic approach to homelessness within the city of Ukiah. Of course, it's going to have coordination with the continuum of care with Mendocino County, but there will be a 2x2 that's going to be established. We want to say thank you to the mayor and the supervisor for their leadership on advancing that suggestion. Number two, there is going to be a series of public community meetings that will be hosted by the county in the weeks and months to come on this project. When we come together, again, the county will be doing the deep dive on what management will look like potentially on that site, taking your feedback on that. That will be an important next meeting. We want to say thank you again, each and every one of you, for joining us. Thank you to Mr. Ross from Housing and Community Development. Thank you so much to Paul Fordham. Paul Fordham is the executive deputy director for Homeward Bound. We want to say thank you to Ms. Van Sant, who has been on fire tonight on all the questions. Thank you, Ms. Van Sant. Really appreciate all your work and research into this. We want to say thank you to the CEO, Carmel Angelo, to the city manager, Sage San Giacomo, to Mayor Crane, of course, and to Supervisor Haschak. We also want to say thank you to Jennifer and Holly, who are our ASL interpreters for tonight. Thank you so much. Ricardo, who's been providing Spanish translation as well. We want to say thank you to Ms. Duquette from the County of Mendocino, who's been doing a lot of the behind the scenes work. Thank you so much to Taylor Morrison, and of course to Carrie Lindecker for all their work and effort on behalf of our office. We've been honored to be able to partner with the city and the county. Until next time, good night, and be looking for that next community meeting that will be advertised by the County of Mendocino. Have a good evening, everyone. Thank you so much for joining, and happy Thanksgiving.
Thank you.